So there is a great deal of data from tertiary care medical centers as well as population-based data suggesting there is a relationship between type 2 diabetes, insulin resistant, and hepatitis C. In fact, previous data has shown that patients with hepatitis C have higher prevalence of insulin resistant and type 2 diabetes. One of the important studies that actually showed this came out of the enhanced data analysis, and this was about 10-15 years ago. It was the enhanced data, which is a population-based data or survey in the United States, and they're basically surveying every few years to obtain a large number of clinical sort of data, historical data, as well as laboratory data. And in that study that was published earlier in 2000, suggested that hepatitis C was independently associated with development of type 2 diabetes. We thought that since that data was a bit old, we wanted to go back to the enhanced and find if the most recent enhanced surveys confirmed that. And in fact, what happened was that we looked at the past 20 years, 3 different cycles of enhanced. And the final sort of result of that study is that in the United States, the prevalence of obesity and the prevalence of type 2 diabetes is increasing, and that's of course well known. However, the prevalence of hepatitis C is stable. Now, if you look at the independent predictors of type 2 diabetes, in the first cycle, which was the cycle that was used previously, yes, hepatitis C was independently associated with type 2 diabetes and insulin resistance. However, in the last 2 cycles that we looked at, and the most recent sort of data was obtained in 2008, these associations were no longer significant. And our theory is that, although at the sort of cellular level and on the individual level, there may be an association between type 2 diabetes, insulin resistance, and hepatitis C, but when you look at population, sort of at the population level, because the population is becoming so obese, that the impact, the association of hepatitis C and type 2 diabetes is now diluted by the fact that we are more obese and more diabetic individuals in our population.